Hi, thank you very much for visiting our YouTube channel or our website. I'm Steve Shore. I'm here to help you with your health insurance for individuals, groups, Medicare. But today we're going to talk about HealthNet Individual and Covered California for 2021. So HealthNet has both in and out of Covered California. Today we're going to go over the direct outside of Covered California where there aren't subsidies and you don't have to submit your income or anything else. It's all guaranteed issue. And so at the bottom of the YouTube video, we will put the links that we're talking about. So let's go here. Basically today we're going to go over HealthNet's brochure, and I kind of feel, well, if the HealthNet marketing department, attorneys, and they got it approved by the state of California, I'm going to go with that and not rewrite the book. So we'll go over that in a second. But anyways, when you hit our website, individuals, healthreformquotes.com, HealthNet, and then we have a separate page for Covered California. Here we have all the details. Right here, it says get quotes and enroll in HealthNet. So you can do that. That's HealthNet's website. It just has coding so that we're your agent. We get paid to help you. Also, if you click on the logo, you'll go right to HealthNet's site. You can enroll and do everything there. We're authorized Covered California agents, but this isn't really the Covered California page. And then if you ever have any questions, you can ask them at the bottom and we'll get back to you. We'll do an authoritative answer, show you how we got to it, and you don't have to just take my word for it. I'll show you where it says it. So going back to the HealthNet brochure, you just click here, and then it'll take you to the brochure effective January 2021. And this tells you almost everything you'll ever want to know. It's got a table of contents, value of coverage. If you didn't know it, you're required now to have to have health insurance. You pay a tax penalty just like they had under Obamacare. All plans include 10 essential benefits like maternity, mental health, pediatric, dental. If you're interested, I have a separate page on my website about that. And then, of course, they talk about how much a hospital stay can cost you and everything else. Enrollment starts November 1st. I know you've been hearing a lot about it before, but it's really November 1st. There's other things that you can do as a special enrollment. I've got a separate page on that. Ways to enroll: visit your local broker. And then we've got here ways to find your costs and coverage. If you have higher premiums, you'll have lower out-of-pocket costs, or you can just insure the big $1 million claims and so forth, and they go in here and take that out. Now, I do have a separate video on that. HealthNet, there's no cost for telehealth. You can get an online account with HealthNet and do a lot of the service work yourself. I personally like that because I hate waiting on hold. Here they've got a page on different ways to get health: your primary doctor, urgent care, specialists, mental health, nurse advice, and so forth. The best thing to do is get a quote. If you want HealthNet, just go straight to HealthNet. But if you want to shop every company, then if you get a quote, here it'll get you a quote from every company, here just HealthNet. And so when you look at the various options, their HMO, their EPOs, their PPOs, and it gets confusing because they got different names for PPOs, but here's a chart on what's available. Then here's more detail on the community care HMO, what the coverages and deductibles are, at gold, platinum, silver. And we do have a separate page on metal levels. Their HSP plans, which is like an HMO. So I know I'm going over this fast. The best thing to do is take a careful look at this, take a careful look at the quote that you get. And of course, we can set up a Zoom meeting with you. For Zoom meetings, if you just go here to contact and then set phone or Zoom meeting. So anyways, this gives you details on each one, the EPO. And if you go and look at the provider finder, I'll show you. Well, let's talk about the provider finder now. Here's our webpage with the HealthNet provider finder. And, you just put in what you want, what your criterion is. Here's instructions how to do it. If you need definitions, we have a separate page. And you saw a lot of those definitions on the brochure I was just showing you. And here it explains how to choose an HMO doctor. We've got a ton of videos for HealthNet, definitions. So I'd like to think that everything's on this website. And if it isn't, just ask me. And, we'll update the website. I love updating the website. So going on down here, they're talking about enhanced care PPO. And you'd think enhanced care really meant that you were going to get more doctors. It was enhanced, but no, it's fewer doctors. And here's, the different amounts of out-of-pocket, deductible between if you get platinum, gold, bronze, minimum, which share of costs are. Full network PPO is going to give you more doctors than their enhanced, and then here's more detail on that. Now here's what I like is they've got a page, page 21, all the different definitions of deductible, dependence, formulary, network, out-of-pocket maximum. I've got a separate web page on that. Preventative care, I have a separate page on that. And then I only speak English, a little bit of Hebrew, Croatian, and Spanish, but not enough to explain it to you. So if you need, some languages I can I know other people that speak foreign languages, I can refer you. But if you're not fluent in English, you're really going to have to Google and find an agent, fluent in your language. There are also, if you email me, there's a National Association of Health Underwriters. We can put that in. And then right here, HealthNet has help in various languages. So let's go through the other pages that I have. Here's if you're with Covered California, their plans are basically the same. There's a mirroring law that says they have to be the same and the same price. So that's pretty much accurate, but not 100%. Here's how to get a member account with HealthNet so you can do so much on your own without having to wait on hold or, asking me to do it. Obamacare cut agent commissions tremendously. And then here's the provider finder information so you can find the doctors that you want. So if you have any questions, give us a call. We'll be happy to help you. Best way to reach us, though, is by email, steve@steveshore.com. Thanks a lot.